Dear all, Namaste. In this video, I shall be discussing about the natural constrictions of the esophagus and their significance, as well as the significance of lower esophageal sphincter, which is important for postgraduate students. Let's come to the natural constrictions of the esophagus. What are they? They are the narrowing in the esophagus. They have certain significance, which I shall be discussing later on. The upper or the first constriction lies at the cricopharyngeal sphincter, which is around 15 cm from the upper central incisors. Why we take upper central incisors is the maxilla is a fixed bone. The mandible is not fixed. Therefore, the distance is always counted from the upper central incisors. Then lies the arch of aorta, which is at the level of T4 and around 25 cm from the upper central incisors. The next is the left main bronchus, which is around 28 centimeters. In some textbooks, including Scott Brown's, the arch of aorta is measured at 23 centimeters. And the lower one is the lower esophageal sphincter that lies at the distance of around 40 cm from the upper central incisors or at the level of T10. These constrictions can be seen in the picture. This table shows the vertebral level as well as distance from the upper central incisors for different natural constriction sites: cricopharynx, arch of aorta, left main bronchus, and the esophageal hiatus. The important thing is, why left main bronchus? Why not right main bronchus? Because the esophagus is not a straight tube. This is slightly curved tube, and the curvature is towards the left side. What are the importance of the constrictions? They are common sites for lodgement of esophageal foreign bodies. Most of the times the foreign bodies are lodged in the upper esophagus, that is esophageal esophagus or cricopharyngeal sphincter, maybe in the middle part and in lower part as well. They are also common site for caustic stricture of the esophagus, because when acid or alkali are ingested, they can stay in the constrictions for a certain time. And the most important is, perforation or injury to the esophagus happens mostly in the constrictions, because we find difficulty to pass through the constrictions. Next is, they also help to ensure the unidirectional movement through the digestive tract. Next is, they also help to prevent the reflux of food and air by sphincter mechanism. The next question is, why is the LES, that is lower esophageal sphincter, called as a physiological sphincter instead of mechanical sphincter? LES is the physiological or functional sphincter because this is not exactly bound by the muscle, or this is not a ring of muscles. So there is no specific sphincter muscles as such. However, the sphincterary function is maintained by acute angle entry to the stomach. As we told, the esophagus enters to the stomach in an acute angle through the diaphragm. Next is, the walls of the intra-abdominal esophagus are compressed when there is positive intra-abdominal pressure, so the food contents usually they don't get refluxed to the esophagus. Next is prominent mucosal folds at the GE junction, which help in occluding the lumen of the esophagus. They are rugae. Therefore, this also acts as the sphincter mechanism. And right cross of the diaphragm has a pinch cock effect to the esophagus. Therefore, the esophagus is pinched. However, during esophageal peristalsis, the sphincter is relaxed to allow the food to enter the stomach. But at rest, the sphincter helps to prevent the reflux of acid gastric contents into the esophagus. So this acts as the sphincter, which is physiological or functional type. I think this is clear to you. This shall be asked in the PG Viva also. Thank you. If you like my video, please subscribe my channel Dr. Krishna Koirala for more videos like this. Thank you.